I think the big challenge that negotiators have is keeping the level of ambition and critically keeping the level of public support that we need in order to take ambitious actions on climate change. And the real challenge that I see there is that pretty much everything that we ask people to do to address climate change is presented as a cost, as an extra effort. So most people accept that we need to cut greenhouse gas emissions, that we need to help protect the planet, but they also have the message that this is going to cost money, it's going to ask them to do things that they don't want to do, and it's therefore an extra burden for them. And one of the big things that observers can do, and scientific organizations like WHO, is to present the now very clear evidence that many of the things that we need to do to address climate change will actually be very good for people's lives in many other ways. So the clearest example that we have is that around the world, about 7 million people a year die from air pollution. The World Health Organization works very closely with the member states. And in fact, at this COP, we are responding to a request that came from the president of the COP last year. So Prime Minister Bainimarama of Fiji, as COP president, one of the things that he did at the last COP was to launch a special initiative on climate change and health in small island developing states with our organization and the UNFCCC. And the reason that was done is because those populations, small island developing states, least developed countries, those are the populations that have released the least greenhouse gases into the atmosphere, but are most vulnerable to the impacts as health. And that is particularly a problem for the most vulnerable countries. So we're now working with those countries to bring forward climate projects to the climate finance mechanisms, which are all about concrete interventions to protect people's health from climate risks. So that's one. The other is that at that same COP, the COP president, Prime Minister Bainimarama, also asked WHO to produce the first ever health report to the COP. We're launching that this week. And so what that report does is to describe all of the positive actions that can be taken to simultaneously cut carbon, increase health resilience to climate change, but also to bring these massive health co-benefits that I've mentioned earlier, particularly from reduced air pollution. We know we need to raise ambition in the commitments that countries need to make. We know we need to raise ambition in countries achieving the commitments that they've already made. The only way we're going to do that is by making clear to people the truth that the benefits that they will get in the short term in healthier lifestyles, in more sustainable cities and communities, actually outweigh the costs of mitigation. So this is no longer a cost, this is something that is good for everybody. So we believe that we need to mobilize those positive arguments to take them to political leaders, but also to take them to the general population so that they understand that we're not just talking about imposing a cost on them to save the planet, we're making an investment that will improve their health now in the future and lead to a healthier future for them and for their children.